Flu cases rapidly rising across the nation, and that includes right here in Travis County. On top of that, RSV cases are also running rampant, with some Austin area hospitals saying they're being inundated with cases in children.
KVUE's Ford Sanders joins us in the studio with what this means for you and your family. Hi, Ford.
Absolutely. Quita, Brian, some doctors say we could see what is called a triple-demic, with COVID, flu, and RSV cases rising all at once. Doctors locally and statewide say this year these viruses are happening sooner than usual.
We're seeing more influenza-like illness in our clinics than we typically see this time of year, and we're even higher than most other states in the nation.
Dr. Jennifer Shuford with the Texas Department of State Health Services says right now the state's flu positivity rate is at 13%. This time last year, 0.2%.
And it also begs the question of, does that mean we're going to have an early peak of our flu season? Or are we just really getting started and that it's going to be a really bad and long flu season?
In Austin, between early October and the 15th, the flu positivity rate doubled. Dr. Desmar Walks is Austin Public Health's medical director and says young kids are at risk.
We're seeing long wait times and a lot of children presenting with respiratory illness.
In addition to the flu comes RSV.
Respiratory syncytial virus.
A virus doctors say is also showing up earlier this year due to COVID-19.
Some people will just feel like they've got an upper respiratory tract infection and it's not as big of a problem, but others will get a really severe lower lung infection.
Austin area hospitals inundated with cases.
Having to wait until there's bed availability at some of the higher level children pediatrics centers, and that's a concern.
But could we see COVID, flu, and RSV cases create what is called a triple-demic? COVID cases are down right now, but Dr. Shuford says that might only be temporary.
We continue to see new subvariants of that virus that causes COVID-19 emerge, and it's starting to cause increased cases in other parts of the world, and even we're seeing rises in other parts of the United States.
And both doctors say getting vaccinated remains one of the best lines of defense against flu and COVID. However, RSV does not yet have a vaccine. They're encouraging people to get their flu shots earlier this year because they take a couple weeks to actually take effect. Quita, Brian.
It's good advice for sure. This time of the year, you see those cases rising. It starts to get a little worrisome for some parents.
I know, and it's a lot earlier now, so they want to make sure you're protected.
Thanks, Ford. Ford Sanders live here at the desk with us tonight. Thank you, Ford.